Hi everyone, it's Dr. Ida Khan and welcome back to my channel Medico's Guide. And in this video, we are going to be discussing about the differences between small cell lung cancer and the non-small cell lung cancer. Now, as you know that the lung cancer is the leading cause of cancer deaths among both men and women. So that's why it's important for us to know the basic types of the lung cancers and to have a basic educational background about it. So basically, there are two main types of lung cancers. We have a small cell lung cancer and the non-small cell lung cancer. And the main distinction between the small cell and non-small cell lung cancer is in their cell size and characteristics. Now, both of these lung cancers, they derive their name on the basis of how they appear, how they look under the microscope. So the small cell lung cancer, they look round and undersized as compared to the non-small cell lung cancer cells. But the biggest difference is that how aggressive they are. So the small cell lung cancer typically grows and spreads more rapidly, and that's why these cells, they are more responsive and they're more susceptible to the chemotherapy. Now the small cell lung cancers, on the other hand, they tend to grow more slowly and they may be treated with the surgery, radiation and targeted therapies depending upon the subtypes. Now, which lung cancer is more common? So non-small cell lung cancer is more common. It comprises about 85% of all the lung cancer cases, while small cell lung cancer accounts for the remaining 15% of the cases. Now let's talk about the types of these two cancers. So there are two types of small cell lung cancers, and these are on the basis of which cells are affected. And these two types are small cell carcinoma and combined small cell carcinoma. Now in the small cell carcinoma, these are also known as oat cell cancers, and this is the more common type of small cell lung cancer. While the combined small cell carcinoma, it's a rare type of small cell carcinoma and it has both the components of the small cell and the non-small cell lung cancer. Now let's talk about the common types of non-small cell lung cancer. So there are three types, and these are adenocarcinoma, large cell carcinoma and the squamous cell carcinoma. So first, in the adenocarcinoma, it starts in the mucus producing cells that are lining your smallest airways. Then the large cell carcinoma, it starts in neuroendocrine cells in the lung. Then the squamous cell carcinoma, it starts in the flat cells lining the larger airways. And among them, the adenocarcinoma is the most common type of the non-small cell lung cancer. A little more detail about all of these subtypes is as following: that in adenocarcinoma, these type of cancers, they are found in peripheries. They slowly metastasize to the liver, bones, they have clear margins, or they are clearly differentiated on x-rays, and they have better prognosis. And these are the most common cancers that are found in the small lung cancers. So basically they range from 40 to 50% of the small lung cancers. Now the large cell lung cancer, so these can occur in any part of the lungs, and these are larger in size and they comprise about 15 to 20% of the lung cancers. Then squamous cell carcinoma. So squamous cell carcinoma, they are moderate to poorly differentiated and they comprise about 30% of the small cell lung cancers. They occur in the larger bronchi, and it means that they are centrally located, and after that they can affect the whole lung. So the prognosis of the squamous cell carcinoma is not good. Now let's talk about the prognosis. So the outlook for the non-small cell lung cancer is better than the small cell lung cancer. Most people find out that they have the small cell lung cancer when it's already spread to the other parts of their body. So early detection helps, but it's often found late because you may not have symptoms. Now with the small cell lung cancer, the 5-year survival rate is less than 5%. Without treatment, the survival is about 2 to 4 months, and with the treatment, it's longer. 5-year survival rate may range from 29% in the early stages to 3% if it has spread to other parts of your body. Now the 5-year survival rate for the non-small cell lung cancer may range from 64% if you catch it early and if it hasn't spread outside your lungs, to 8% if it has spread to other areas of your body like your brain, bones, liver and other lung. Now what are the risk factors for the lung tumors? So first of all, it's more common in the males. Then smoking history, there can be an old age, airflow obstruction, genetics, occupational exposure in which, for example, the person may be exposed to the asbestos or other radioactive components, then the TB, family history, then the diet. So all of these can be the risk factors for the lung tumors. Now, what investigations are carried out in order to diagnose these lung tumors? So, there are various tests and scans that are performed, and these includes X-rays, CT, HRCT, that is without contrast. Then we have bronchoscopy, cytology, that is to examine cells, and this is done via the help of a sample of the sputum. Then the brush biopsies, endoscopic ultrasound, bronchoscopic ultrasound, tumor biopsy. So these are all the investigations that are carried out. Now for the staging of the lung cancers, we use the TNM classification, and as you already know about it, that here in the T we have 4 grades, and the first grade is when the tumor size is below 3 cm, then the second grade is when the tumor size is between 4 to 7 cm, then the 3 is when the tumor size is above 7 cm, and then the 4 is when it has invaded to the local organs. Now in the N, which is for the nodes, so the 1 grade is when it is spread to the local lymph nodes, then the second is intermediate, and then the third one is when it has spread to the distant lymph nodes. Then the M is for the metastasis, and here the 0 means that it hasn't metastasized, while the 1 means it has metastasized. Symptoms of the patients with the lung cancers are orthopnea, hemoptysis, weight loss, fever, pleuritic chest pain, etc. Now for the management, we have chemotherapy, radiotherapy. For the surgical management of the lung cancers, we have wedge resection, segmentectomy, lobectomy, and pneumonectomy. Okay, so that's all from my side, and I hope that this difference is clear to you. If you enjoyed this video, don't forget to hit the like button, subscribe to my channel, and thanks for watching.